Colorectal cancer is the third leading cause of cancer death in the U.S. The American Cancer Society estimates that over 136,000 Americans will be diagnosed with the disease this year, and nearly 50,000 will die from it. If found and treated early, the 5-year survival rate is 90%, yet even more lives could be saved through early detection and lifestyle changes. The specialists at Advanced Gastroenterology and Surgery Associates explain how colonoscopies play an important role in early detection.
Colonoscopy screening is extremely important, and I think it's important to note that colon cancer is the second most common cause of cancer death in the country, and the third most common cause of cancer in men and women. And most patients are reluctant to have the procedure performed, but it really is a preventable form of cancer, as most cancers are. Colon cancer develops from an ingrowth of the lining of the mucosa, what we call a polyp. And there are certain types of polyps, the ones that are adenomas, that can grow and eventually turn into colon cancer. It's important to note that the adenoma cancer sequence takes approximately 6 to 10 years. So every patient that we see with colon cancer, they've had a polyp growing in them for a long time, which can be prevented because when we do colonoscopies, we remove polyps. Now, of course, there's some colon cancers that may develop a little bit more rapidly, but the average time interval is 6 to 10 years. So it really is a preventable form of cancer. There's no difference between the genders. However, we start on the average risk person. We start screening at the age of 50. And if that person has no polyps, or they have what are called hyperplastic polyps, then the recommended next screening interval is in 10 years. Now, if someone has a family history of colon cancer, then we usually start in the 40s or 10 years before the youngest age of the person affected. For instance, if someone has a family member that was diagnosed with colon cancer in their 40s, then that person should start in their 30s. If someone has had previous colonoscopy and they had the adenomatous polyps that I previously described, then that person could be on a 3 or 5 year schedule depending on the size and number of polyps. The actual procedure itself is relatively benign. Patients are sedated, either with moderate sedation or some even with general anesthesia. So the vast majority of patients don't recall the procedure or have any problems with it.
Of additional interest, a new study in the Journal of Clinical Oncology suggests that coffee may have an impact on colon cancer. Scientists say that patients who are heavy coffee drinkers have lower risk of dying, and those who drank 4 or more cups of caffeinated coffee a day cut their cancer reoccurrence rate in half when compared to non-coffee drinkers. But don't go reaching for that tall latte just yet. The researchers say that more studies need to be done to rule out any other explanations. For more information on colonoscopies, as well as other treatments and surgical procedures available at Advanced Gastroenterology and Surgery Associates, please click the Colon Care StoryLink icon on our homepage, yourhometownhealth.com.